Hello, hello, hello. Assalamu alaikum. Ji ayanu. Pakhair ragale. Ni hao. Chune shumme. Washmale. Ohio Gonzaimes. Guten Morgen. Hola. Bonjour. Privyet. Kaifa hal. Hala shume chatore. Ahlan wasalan. Marhaba. Huya morkhe. Buna. And a very amazing good morning to everybody who's tuned into PTV Ball and are watching Ball this morning alongside the very amazing, the very talented Shiza Hashmi and Shahzad Khan. Hello Shiza, how are you today?
I'm great, how are you?
Absolutely perfect. So it's Friday today. How do you feel?
Oh, I feel absolutely amazing. It's Friday morning finally, but it's hot outside. It's a clear sunny day, which is great after, so many rainy days.
Yeah, but I think that the weather's changing and everybody out there needs to be very careful about it, ladies and gentlemen. The monsoon is actually coming towards its end. And how I can feel that the weather is changing is that earlier, thank you Allah, that we were able to actually sit down in rooms where we can turn on the air conditioning for 24/7. But now I need the feel, I feel it that, I have to turn off the air conditioner because it's getting cold. Even in the studios today, ladies and gentlemen, it's getting cold. So we should actually be careful about it. But other than that, we can even save more energy and we can actually help Pakistan get out of, the crisis of load shedding too as well, which we are pretty much out as well.
Almost.
What about you? What are your plans for the weekend?
You know my plans for the weekend. I have work and I will work. Well, the best thing is, I love how we totally inspired for Friday.
Yeah.
Before we move on to tell you what the show is about, I think we should take a look at the top picks for this hour. And
let's do it. Top stories coming up. Good morning.
Well, the U.S. decision to waive individual licensing requirements for export to India is disturbing and discriminatory. Foreign Office spokesperson says this will further erode long-standing non-proliferation norms.
Ooh. Moving on, where Foreign Office spokesman says recent call of Indian Prime Minister Modi to Pakistan Tehreek-e-Insaf Chief Imran Khan can help melt ice between the two countries. I think we should already be breaking ice now. I think it's
about
too long.
time.
Yeah.
But also, the Foreign Office summons the Indian Deputy High Commissioner J.P. Singh in Islamabad to condemn the unprovoked ceasefire violations by the Indian occupation forces along the line of control in Mandal sector.
Which is sad indeed, ladies and gentlemen. But other than that, moving on, what are we talking about today? So, ladies and gentlemen, yesterday we were talking about childcare coaching, and I think it was a very important topic to have been discussed on the show as well, because this was the very first time. But now moving on.
Actually, we got an amazing response. There were people calling me,
Really?
Yeah. Especially women, my friends who are young mothers, they were calling me. They said it is very informative. And they would want to actually watch something again. And we shall be having a similar show again.
I think that's amazing. And it always feels great when, the feedback comes in and while you're reading the mails and everybody's talking good about the show. It's always fabulous, ladies and gentlemen, makes our day. But now from 1st of August till 7th of August, ladies and gentlemen, globally, do you want to talk about it? Breastfeeding Week is actually being observed. Now, when we talk about breastfeeding, ladies and gentlemen, I think breastfeeding should actually be the fundamental right of the newly born as well. And I think it should actually be within the Constitution as well, that, it's a kid's right. Now, Shiza, what I don't understand is that, I think that we are going back in time now. Because earlier, when we didn't have all of these powdered milks and all of these products, what do you think that the mothers were actually feeding their babies with? It was only breast milk.
Yeah, that's true. So when I usually talk to my parents, and my parents are always like, we're stronger than you guys are because of all the intake that we had, which is true.
Yeah.
In their times, I feel like there were no substitutes for breast milk, which is great. So they were, directly exposed to breastfeeding immediately after they were born, which is why the immune systems are stronger than us, which is why they're still functioning so much better than we are at this age.
Exactly. And ladies and gentlemen, imagine that, if, for example, a baby is born and within the first hour, if he or she gets the mother's milk, it is going to save her or him from so many different diseases that you cannot even imagine. And it's the first ever vaccine for the baby too as well.
Yes.
Other than that, we can save almost 825,000 babies by giving them mother's milk too as well. And then they won't be malnourished. And if the kids are actually going to have mother's milk for the first 6 months, he or she will never be afraid of getting fat too as well. I think that's the most amazing part. So all of those babies who are roaming around, please don't go around judging that, oh, you didn't actually had your mother's milk. So please don't do that. But this is very important. We need to spread awareness about it. And for example, in many areas over here within Pakistan, we know that we have a problem with clean drinking water.
Yes, of
so
course.
imagine rather than giving a baby a product mixed in some dirty water, what we can do is they'll probably prefer giving them mother's milk. But over here, we have been joined with some amazing guests who's actually going to talk about it. Why in the first place we have moved on to the products, and then we're going to come back to the crux of it as well.
Yes, of course.
Ladies and gentlemen, we have been joined by the Chief of Nutrition, UNICEF. She's none other than Miss Melanie Galvin. I hope that I pronounced it right.
You did.
Hi, how are you? Good morning. Thank you very much for joining us.
Excellent. Happy Friday.
Yeah, happy Friday.
Friday
Thank
to
you
you
very
too.
much for joining us. So let's start the conversation. First things first, are we going back in time or are we correcting our mistakes?
We are going back in time. That's an excellent question. We really are going back in time. For some reason in Pakistan, we're starting to see substantial declines in good practices like breastfeeding over the past 6 years, 7 years. Some of the percentages have halved.
Okay.
For example, if 30% were breastfeeding exclusively, now we're seeing 15 or lower. It's a real stark change in the country, I would like
But
to
do you
say.
also feel like in countries like Pakistan and elsewhere, infant mortality rate is directly related to breastfeeding?
It absolutely is. You said this at the beginning, I think. We know that children that are breastfed, and the first couple weeks of breastfeeding is like liquid medicine. It's like liquid immunization, really,
Right.
and that gets passed on to the child. It can't be replaced any other way. It can't be replaced through formula.
Okay.
If the child doesn't get that through breastfeeding, he or she misses the opportunity. So it is absolutely critical and is absolutely life-saving. So we
Okay, so I
do
think
make
that,
connection.
first things first, let's get the theme out as well, which is breastfeeding, foundation for life, a recognition of the importance of breastfeeding to a baby's future. Why this year you have picked up on this theme in the first place, breastfeeding, foundation for life?
That's a good question. Pakistan this year, there was a global report on infant mortality. And Pakistan has the highest rates of infant mortality, which came as a shock, a little bit of a shock to us. There's no reason why a country as rich and really well-educated as Pakistan is seeing this. Yeah, sorry, can you repeat that question?
Yeah, I was talking about this year's theme. Why do you think particularly they picked up on foundation for
So
life?
because that report was released, it really allowed us to make a connection in this week of awareness where we hope to raise an awareness a little bit about how we can improve the situation for Pakistan for infant mortality, essentially.
Okay.
Breastfeeding is good for a lot of things, not just its healthy development of a child. Here we're focusing on that survival aspect.
Okay, so before we move on to anything else,
sure,
this
go
is a
ahead.
very basic question. When you say you're awareing people, and are you holding seminars? How are you doing this? How are you going on about it?
We try to do everything. It's hard because there's a huge number of doctors, there's a huge number of children in this country. Families are large and there's a lot of children. We have a lot of people we have to sensitize.
Right, right.
The government and UNICEF works very closely with the government, of course, in all cases. We develop programs for doctors. We develop programs for journalists. We've tried to raise awareness of these issues. With journalists, for example, we always try to talk to mothers. We talk to them in the communities. It's very effective if you do face-to-face communication with families, mothers in particular, but it's not always the mothers. Fathers,
Of course.
equally important.
Yes.
And sometimes we find, which I think you all know, but grandmothers, mother-in-laws, there are very key people that give messaging for us that we have to educate and sensitize.
They are, and it's great that you've mentioned the family system over here within Pakistan as well. But what happens is once you talk about your in-laws, things get very different, and it's hard to convince, right? So grandmothers and all of these people who have actually been into the practice of breastfeeding their kids, now even if they recommend their in-laws or probably their daughter-in-law or anybody else, they're not of the idea. So what we have to do is that we have to distribute the areas. Let's take rural away from urban, because urban practices are more aligned with fashion and how to be in shape and how to look good. But in rural areas, what are the figures? Can you share how are things in rural areas? Are they better than the situation within the urban area?
Well, we're starting to see a shift. Urban areas have always been better. It doesn't matter what health parameter you want to pick, and urban areas usually has better practices than rural areas. It's highly related to wealth, a little bit more than geography, but it's geography that we see. But there's no question. So what we have to do now is target we're seeing a shift for families moving from rural to urban environments. So we can't afford to forget about the urban environments where we've done a lot of work in rural because we consider that there's a lack of education, so they need more awareness, more campaigns. I think everything's shifting a little bit for us around. UNICEF, we deal with the most vulnerable. We're interested in the poorest families, and we will work with them no matter where they are.
All right. Yeah. Okay, that's great. But then what makes me think of this question is, then why do you think that women are unable to breastfeed or continue breastfeeding? What are the main causes for that?
Well, that is the million-dollar question.
Thank you very much. I'm known for that.
Medically, there's very little reason why a woman couldn't breastfeed.
Okay.
Even if I had a pool of 100 severely malnourished women, so the worst of the worst off, if I took 100 women, only 3 would be unable to breastfeed due to severe malnutrition. Okay. So a lot of the arguments that we hear against it are simply not accurate and not medically correct. What we do think, and you alluded to this earlier, we do think doctors are unaware of the benefits and therefore not passing on that information to families. Right. We think that there's been, one of the things we do know about Pakistan, unfortunately, is that there's been a great deal of marketing by formula manufacturers. And they've been able to really get the message across, an inaccurate message, that it's healthier to use formula. And because they have a lot of money and they can advertise, and none of us can reach the level of kind of advertising reach that they can have, that message is really quite pervasive now. So as we've seen rates of breastfeeding drop substantially, in the exact same time we've seen rates of formula use go up.
Obviously.
Yeah, of course, of course.
So we think that's the key, actually, shift in so very strong marketing by multinationals and then not met by strong programs on breastfeeding on the other side. Yeah.
Okay, so last night I was reading a report, and I have to say that there's not enough, I don't know, we've talked about it, and there's not enough proof of it. But kids who have been breastfed in the early ages have less immunity issues as compared to those who have been treated to substitutes. And they happen to have higher IQs, what actually I read. Is this true?
Yeah.
Good nutrition in general will lead to better development and brain development of a child, so there's no question about that. Whether or not it's particularly breast milk, it's really the vitamins and minerals in breast milk. And so as long as a child's getting the vitamins and minerals it needs, we will see better IQ development. And of course, as we mentioned, just out-and-out survival. But IQ and immunity in later life is absolutely, without question, a scientific fact related to breastfeeding, which we cannot say about formula. And that's why it's so critical for us to get the message that a woman needs to breastfeed really quite quickly after delivery, within the first hour. It's quite critical. And that very early stage of milk, it's like I said, it's like liquid medicine. It's essential in the first 2 weeks. We just can't replace it. And so we need to get that message out.
And I think at the same time, the message needs to be the other way around as well, because what I read was that, it is very healthy for the mother too as well. So can you shed light on that?
I was about to ask this.
Yes, absolutely. Again, scientific evidence, not just for the child, long-term benefits for the mother. There are reductions in cancer. And in breast cancer, ovarian cancer, sort of reproductive related, I guess you could say, cancers. And that evidence has been clear and consistent as well. So there is, for mothers, in the end, it is up to a woman to make a choice. But there are very, very clear benefits why breastfeeding is good for her in the long term. There's also the short-term psychosocial bonding with the child, which is beneficial to the mother as well, as the baby, of course. And then for the baby, short-term benefits, and then lifelong benefits around immunity. So good on all fronts.
So, Ms. Melanie, just a while ago, you said that you're also reaching out to doctors to see how aware they are. So is it safe to say that maybe some of the doctors are misinformed as to what they are referring their patients to?
Or are they doing it intentionally?
Yeah, in form of substitutes.
I don't know about that. It's safe to say they're misinformed. And we're working on the premise that they're unaware of really fairly substantial evidence and the cohesive body of evidence that supports breastfeeding. We do know they're marketed to by formula manufacturers. We do know they get information. And what that information is, I'm not 100% sure. So we do feel they're probably misinformed as well. Once we can educate them, sensitize them, resensitize them, because they probably learned this in medical
Right,
school
right.
as well. I think we're seeing a shift, and I do want to make that point.
Okay.
Only recently have we started to see surveys show us a little bit of positive change in what we call exclusive breastfeeding, or breastfeeding a baby exclusively from the breast for the first 6 months.
Yeah.
So we're starting to see that shift. We're still seeing worrying declines in this, what we call early initiation of breastfeeding, which is breastfeeding in the first
Well,
hour.
I have a different question.
Okay.
So when you say,
Okay.
where are you going
Yeah,
now?
go ahead, go ahead.
So when you say breastfeeding, in rural areas of Pakistan, there are people called midwives. So actually sometimes if the mother is not, maybe she's not producing milk, the midwives are supposed to feed the baby. So that way the baby is getting all the nutrients, but what about the mother-baby bond?
I'm not sure whether this happens anymore or not.
Yeah, I don't know if I hear.
Yeah.
It does. I've actually seen people in
You've
this.
seen this.
Yeah, yeah, yeah.
This isn't. I have not seen it here, but it does happen. So
Right.
I don't. Let me
Yeah.
not discount that. I think you hit the nail on the head of something that's been missing in the country for, well, probably hasn't really been done very well at all, is what we call lactation management. So supporting a mother in breastfeeding, because breastfeeding there can be difficulties,
Right,
of
right.
course.
Yeah.
It is lady health supervisors are a group that are being taught to support a little more specifically on issues related to kind of breastfeeding problems, because we would like women to breastfeed as long as possible, and 6 months is what we recommend,
Yeah,
of course.
Yeah, I want to put the picture the other way as well, because Melanie over here, ladies and gentlemen, have actually opted to be very modest and humble as well, and this is why, she states that, the doctors might have been misinformed. Now, for me, as a layman, what I can think is that for somebody who went to medical school for 5 years and then, they had to do their specializations, I don't think that there's any way that they can be misinformed. So you are a better judge of that. But now, over here within Pakistan, we've been listening to this, since I'm a father myself, that, you should always breastfeed for 2 years maximum.
Yeah, yeah.
Why are you guys talking about just 6 months? Is it to actually get them to breastfeed first, or?
We talk about 6 months. All a baby needs up till 6 months of age is found in breast milk. Enough calories and all the correct vitamins and minerals. At 6 months, a child's actual needs for growth are greater, and they need more calories and nutrients than breast milk could provide. So at that point, as you know, you start to introduce different foods. For 2 years, it's a critical period in the child's life for kind of irreversible beneficial effects of vitamins and minerals, and which is why we would like breastfeeding up until that point as well. But they, of course, need a richer diet of a variety of foods.
So then what kind of monitoring system can we use to track the breastfeeding trends? Because then we'll have to actually have the figures, and I think that we lag behind within the data and the figures too as well. Do you think that there can be a tracking system for that?
Yes, I think the government has been working on that. And even some provinces we can track through data collected by lady health workers, for example, and through the information collected in health information systems. We do have some breastfeeding indicators, what we call them indicators, but tracking mechanisms embedded within these systems, and we will start to be able to see month-to-month data on what rates are. And that's, as you say, it's critical because we can correct. We shouldn't be at this point where things are so bad. We should have known a lot sooner things were getting bad and taken measures earlier to correct them. And information systems will allow us to do that, of course.
And then since you're representing UNICEF over here, which is United Nations International Children Education Fund.
Right.
So by the end of the day, it says fund, right? In which areas do you think that if there are funds, will be allocated that, okay, this is something which we need to do, or this is something the government needs to do? How do you think that we're going to distribute, and so that in near future we'll know that, we're going towards a better position or towards a better direction?
For UNICEF, of course, UNICEF has a number of sections. Nutrition isn't their only one, so we do have to be smart and thoughtful about how what we fund and where we fund. UNICEF has been always very good at communications and advocacy, and so we put money into supporting governments in terms of their awareness campaigns, for example. That's some place where we feel we can add value. We develop training modules, for example. We can work on the development of those, and then we can hand them over to even pediatric associations, obstetrician, gynecological associations, GP associations in general, and the government to fan those out. So we're smart about what we do. We use seed money that then we give to people to roll out in a broader way. And that's how we're, so training and communications, and for us developing the monitoring systems that you were talking about, those are critical, actually.
And
those
one
are
last
things we
thing,
work
and
on.
that is, do you think that, these maternal and paternal leaves are actually going to be very uplifting, or probably, they'll uplift the morale of the parents too as well to do what they wanted to do? Because over here in Pakistan, we do not have a trend of maternal or paternal leaves.
It is a really wonderful time for families to spend together for bonding and child development. And a lot, I guess you were talking about early child development yesterday, but we do know that that interaction, the ability to interact with the child, play with the child, is critical in very early stages, again, for brain development and IQ.
Right.
And it's wonderful for the parents as well. And we absolutely advocate for maternity and paternity leave. And at UNICEF, we provide it. So I would love to see the government do it.
Well, it was so great having a conversation with you. But before we wrap up this segment, is there anything you want to say to young mothers or mothers at all, or anyone who is associated with young mothers? Here you go.
Say to young mothers. We want you to know that breastfeeding is best for your baby, despite what you may hear or see in advertising. I know it may not always be that simple. It may not be women work. It can be very difficult to try to breastfeed for 6 months, but we think the benefits to you and the baby are so critical that it is definitely worth the effort. We'll do our best to support the government in providing mechanisms to support you and your family in that critical 6-month period.
Amazing that is. Thank you very much for being with us, and you're definitely looking very amazing in our national dress too as well. You pulled it very well. Thank you very much, Melanie. And for all those people who are out there, I've always been saying it, we always say that too as well, that the strongest marketing tool is word of mouth. Please make sure that whatever you've heard, you keep around, you keep on going around, pass it on to people. Tell them that this is what you need to do. They're newly married couples, because over here in Pakistan, weddings never stop. Tell them that, this is what you have to do, because parents are always in love with their babies, but all they have to do is to be very aware so that, they can rear him or her in a kind where they do not have to face any problems in life or developmental issues.
Yes, of course.
But right now, ladies and gentlemen, we are going to go for a short break. Don't go anywhere. We'll be right back. Good morning.
Stay tuned. Welcome back to World This Morning. It's a bright, clear, sunny day outside, and we're having a great time. In our first segment, we were discussing breastfeeding, because this week, from the 1st to 7th of August, we are observing Breastfeeding Day, and we are awareing people all around the world. And this was actually an initiative of the World Health Organization. And it's great, it's great. We had quite a good conversation with Miss Melanie in the first segment. And this is sort of in line with that. We are talking about gynecology problems, gynae problems, I don't know what we say. So gynae problems in women, and for that, we have the perfect person to talk about.
Exactly, but before we do the introduction, ladies and gentlemen, earlier since we were talking about breastfeeding, it obviously, there's a time when, the mother's pregnant, and then the delivery part takes place, and then obviously breastfeeding comes. So we are going to take you back where we're going to talk about all the pregnancy-related issues, or probably a few of them, keeping in mind that we've got less time left. And then we'll move on to the delivery issues as well. And then there are some other myths to it as well. And the question which I asked yesterday was that, how can this be possible that for the first trimester and the second trimester, nothing happens in the third trimester.
You can't figure out all the issues.
It's almost the delivery time, and then a nurse comes in running saying, oh, it's an emergency, we have to do a C-section. So we'll ask all of these questions, but other than that, I think we'll be talking about the most common problems, and for that particular reason, she traveled from Lahore all the way just to be on the show as well. We're very glad, we're very happy that she did it. And she's a gynecologist, she's an obstetrician, she's none other than Professor Colonel Dr. Nazli Hamid. Hello, Assalamu alaikum, how are you?
Walaikum assalam, just fine, doing great.
Thank you very much for joining us. So let's get the conversation started. The most common issues during pregnancy.
But before that, I have a question.
Oh my God, man.
No, it's actually, so you're
Why can't it be after that,
Because it's actually, you will realize that this needs to be asked first. You're a urogynecologist?
Yes.
Yeah.
So for a person like me, can you explain it? I feel like there are two different things. A gynecologist, especially for, different reasons. And when you say a urologist, it's related to kidneys. So what does this mean?
So urinary tract is not just kidneys.
Yeah,
it's the lower urinary tract as well.
Okay.
And the lower urinary tract is very close to the reproductive tract as far as development is concerned, and as far as the trauma it has to undergo during childbirth and related processes, and then also in very close proximity anatomically. So this is actually the gray zone between the two areas, where a patient keeps on being she's constantly being referred by gynecologist to urologist and urologist to gynecologist, and she's just shuffling with her problems, totally being ignored. So this is a recognized subspecialty internationally. So it's not something local. And now, in the recent couple of years, the College of Physician and Surgeon has also accepted it as a subspecialty in Pakistan. And now we are doing subspecialty training programs in Pakistan in this subspecialty.
Okay, that's great.
Have you got your answer?
Yes.
Can I get mine now?
Please.
All right, so most common issues.
So the most common issues, obviously in Pakistan still the most common issues are the maternal mortality, the perinatal mortality, and the safe delivery. Coming back to that part of introduction that you covered, I would say that the two entities are not normal delivery and cesarean delivery. The two entities are vaginal delivery and cesarean delivery, and both have to be safe. If any of them is not conducted safely, any of them can have disastrous consequences. And recently, especially related to my subspecialty urogynecology, we were coming across a paper where one of the leading urogynecologists in the world, he actually, put across a question that we counsel women enough regarding the risks of cesarean section, but do we ever counsel them regarding the risks of a vaginal delivery?
Yeah, I don't think so.
The childbirth trauma, the pelvic floor trauma, and the potential of developing incontinence. So the point remains the same. They are two different modes of delivery, and none of them is normal. They are two different procedures, and both of them have to be conducted safely for a safe maternal and fetal outcome.
And I think it is very important as well. Thank you very much for adding this to our information, because that's what we used to call. And obviously there can be different repercussions for all of the procedures done as well. But now let us just come down to where we were to talk about the obstetric problems which you might have seen in the recent years. And then other than that, why do you think that always when a woman is pregnant, we have to give them those iron capsules, folic acids and whatnot? Do you think that the mothers over here are malnourished, their diets are not right? Because I think these are very common problems too.
So the folic acid is given to optimize the growth of the fetus, and it is an international recommendation. Again, women have to start folic acid at least 3 months ahead of pregnancy, and that is to prevent certain neural tube defects and other fetal anomalies as well. So and iron, because of an additional load of requirement that our routine diet is not going to fulfill. So that is given as a routine supplement. This is an international recommendation. Even a patient who is very well nourished should be given iron supplements during pregnancy and folic acid as well. Folic iron we generally add after 14 weeks of pregnancy because vomiting and nausea settles, and then we add it. Folic acid instead has to be started 3 months ahead of pregnancy.
So no matter what you eat, no matter how healthy you are, this is something which needs to be done.
This is actually something which is recommended internationally.
And it's for your betterment. There are no side effects for that too, I guess.
Yes.
And now moving on to the obstetric issues as well.
The obstetric issues, as I said earlier, like anything that you finally undergo, whether it's a vaginal delivery or cesarean section, has to be safe enough. And regarding the issues like like I will quote an incident. Like I have been in army, and I've had the privilege of
That's how we introduce you. Yeah.
Yes, working in very remote areas as well. So I was in Balochistan, Quetta, way back in around 1995, 96, and I had a patient, 16 years old girl who delivered a conjoined twin at home. Conjoined twins, you understand, they are two twins who are united with each other. They are plastered with each other.
Okay.
I still cannot imagine, how such a young girl and delivered a conjoined twins at home, and once she reached us, her bladder was completely lying outside the vagina, and both the ureters, these are the tubes which carry urine from kidney to the bladder, they were visible outside her legs, they were visible right there. And because I had a passion for this area right from the beginning, so I took on the care of her in obviously a collaborated manner involving our urologist and surgeon at that time. And surprisingly, her husband disappeared, once we took the patient to theater, and for the next 3 or 4 days, the husband was not there. There was nobody to provide medicines to support her. And, we were arranging everything by our own resources. After 4 days, I just saw the husband, outside Chiltern Market, and just recognized him from the back. And we just went after him and, stopped him. And I said, your wife is in the hospital and you're not there?
Yeah.
And he said, how much money has been spent on my wife? So at that time, it was about 30,000 estimate.
In 1990s?
Yes.
Oh
so
my God.
he said, I can get a new wife in 30,000 rupees. Why the hell should I spend 30? So this is the state of affairs in Pakistan. So, and then I will quote another incident in Kharia. I received a patient who delivered in a private clinic, not a home delivery.
Okay.
So she had delivered in a private clinic, and after a previous one cesarean section, this time she had a normal delivery, so-called normal delivery that you were referring to. And the baby had died.
That's all I know, I mean,
yes,
honestly.
Yes, I mean, that's why I'm just addressing that myth, that the child had already died, and the mother died within 10 minutes of arriving at the hospital.
Okay.
And when I spoke to the parents of the girl, they were absolutely satisfied because they thought that the previous doctor was incompetent who did a cesarean section. And these doctors were very competent who could perform a normal delivery despite the fact that the previous doctor had told that the woman cannot undergo a normal delivery.
Right.
They were disregarding the fact that the child has been lost, that the mother has been lost. So I would say that striking a balance is important. You should not be obsessed about any particular route of delivery. Whenever we say we advise a cesarean section, that is a responsible decision and that is shared with the patient. And obviously, the mode of delivery is not decided in first or second trimester.
Okay.
It is generally decided by the end of the third trimester, unless there are certain absolute conditions present right in the first and second trimester where we do tell patients ahead of time.
Okay, then let's talk about that. So do you think that the parents or probably, people who are expecting right now should be actually looking forward to a C-section or to what we refer as a normal delivery? Or what are the differences? What to opt for? And if in case of emergency, do you think that anybody can hold back? Because, God forbid, if a nurse comes in running and says that, there's an emergency, the umbilical cord is just around the neck of the baby and you have to do something, we have to operate, we cannot even move the patient from one hospital to another. There's no time for any other recommendations or for another opinion. So how do you think that anybody else can manage who's a layman?
I think the counseling should start, right in at least in the third trimester of pregnancy, anticipating the examination findings which are there and the investigation reports which are there. And then the decision has to be rational and the responsibility has to be shared between the patient and the doctor.
Yes.
Because every procedure, as I said, has got a set of complications as well. And most of the times, because our patient is uninformed, they want everything to be perfectly normal. If you tell them about even a 5% risk of complication of one particular thing, no matter how much you emphasize that there is this much risk of complication in this procedure, and then they will say, Doctor Sahab, sab kuch theek ho jayega fir uske baad. So it's just like you have to accept the joint responsibility. The decision has to be made by the patient. Our job as a doctor is to make the options clear to the patient.
Exactly.
The pros and cons of vaginal and cesarean section in her particular case. We cannot generalize.
So in what, okay, let's not do that. Let's be more precise. So in which conditions do we have to opt for C-section? And in what conditions do we actually have to what we refer to as a normal delivery?
So, yes. So like if there are absolute factors like, you know, the pelvis is contracted, if there are absolute factors like there is a placenta which is obstructing the birth passage, or there are tumors which are obstructing the birth passage, then there are absolute indications for vaginal a cesarean section, and they are told to the patient way ahead, you know, of labor. They are not announced in emergency. But unfortunately, what happens is that even when you tell, even being honest, although I still try to always be honest with my patients, but I think at times it pays you back negatively as well, because you tell a patient that, see, you cannot undergo a normal delivery, vaginal delivery, and you need a cesarean section, and that patient will probably run away to another doctor who would understand that she actually needs a cesarean section, but tell her, okay, we'll give you a trial of labor, and then, you know, create a situation. And this is generally not done by qualified doctors. This is done by, you know, the small clinics and places like these, the midwife clinics and those. They would just put a plain drip to the patient, and then, you know, give 5-6 hours of that plain drip, and then they'd say, okay, now you need a cesarean section, the sort of situation that you were referring to. So that is probably not done in, you know, good and big hospitals with trained people. They are the options generally created, or scenarios created by people who are not very well trained, and who want to handle the psyche of the patient, that normal delivery was tried to, no matter what was.
So what you're trying to relate to is that, you know, we should always opt for a doctor from a reliable source.
Yes.
Or from a better hospital. And you know, it is very important, ladies and gentlemen, we need to offer some amazing medical services too, in case, because health as well. Now, other things, I think we need to move on to now post-delivery. Now, you know, even our producer at the back of the studio was even talking about that, you know, his wife is still sick and she hasn't recovered because of the negligence of the doctor. What kind of complications can be there after the delivery or post-delivery?
Well, related
and how
to that,
deal with them?
Yes, there can be so many complications even after a vaginal delivery. And like 3 days earlier, we had a free fistula treatment camp at Shalimar Hospital in collaboration with Pakistan National Forum on Women's Health. And in that, we actually dealt with patients who had complications of a vaginal delivery. We operated on a patient who was having fecal incontinence, like she was passing free stools all the time for the last 13 years. She has had 5 vaginal deliveries at home. And, you know, I had to really call her like 100 times for this free camp, because even with all the free offers, she was saying that I have to take care of 5 kids at home, and if I can come and get admitted for the surgery, who is going to take care of my kids? So that is the state of affairs of women's rights in Pakistan. You know, nobody is willing them to relief. Even for this, you are not being charged, for God's sake. We are giving you treatment free, we are giving you investigations free, the surgery is free, and a high-tech team has, you know, accumulated to perform the surgery, but still, but eventually, fortunately, we could get hold of the patient and we operated on her. And then we had another patient who, after the vaginal delivery, she had developed a free communication between the urinary passage and the birth passage, and she was passing urine all the time. She has had previous 3 attempts at repair which failed. So even this patient was so reluctant and so shaky and so, I mean, having lost her confidence in repeat surgeries, that she was not coming to the hospital at all. Cutting short, I was out of 7 patients which I got, you know, as a referral, I could convince only 4 patients for free treatment in the hospital.
Why that? Why are they not open to the idea of it?
I think it will open it up the next time better, because once they get to know that, okay, a good job was done, and as you said, the word of mouth is the best publicity. I think these 4 patients, when they go out and they tell other people that we were taken care of, and you know, we got a good result.
Okay, but then at the same part, you know, these cases.
This was the very first camp that I performed, you know, and then I intend to repeat it on quarterly basis.
No, but these cases which you have mentioned, why do you think, what were the reasons behind, you know,
they are generally,
problems?
you know, where midwives were obsessional about the abdominal delivery, you allow prolonged labor where the urinary bladder or the rectum, they keep on getting compressed between the bones and the fetal head bones. And so once the baby is delivered, 2-3 weeks later, you realize that all the area which was compressed at that time and was deprived of blood supply has undergone necrosis, and now a free communication has developed and patient has started leaking. Besides, there are iatrogenic injuries as well, like if ill-trained people have performed, surgical procedures like hysterectomy, removal of a uterus, or a cesarean section. So 2 of those patients, one was post-cesarean fistula, one was post-hysterectomy fistula. So they were both iatrogenic. Iatrogenic means, a complication which has arisen out of a medical treatment. So that was probably because of inadequate training of those doctors. So obviously, we need to focus more on training our postgraduates as well. So that answers your second question as well, because you were referring to that the senior doctor didn't come herself and you're a junior doctor. The junior doctor does not always mean that she is a non-qualified person. We have to pass on the training and
there
the
are doctors who shadow you
and there are doctors who are shadowing us, and they need to be trained under supervision.
Right.
And so those are supervised deliveries actually. In a well-equipped tertiary hospital, which is a teaching hospital. So the doctors there are to be respected. They are the ones who have done 5 years of medical training, and then at least 2 to 3 years of their postgraduate training, and then they are allowed independent procedures.
Okay, but before moving on to anything else, this question that I'm going to ask you is actually on behalf of all the women who knew you were coming, and the age group that is actually entering into menopause. So naturally, when you are entering into menopause, you have certain bodily changes, and you have you become weak as well health-wise. So are they missing out on something in their early years that they should have taken maybe for a better passage of menopause?
Menopause is a natural event which is going to happen anyway. That is because of decline in the natural reserves of the ovary, the population of eggs that you were born with, and then that that falls below a critical level, and then a woman enters menopause. Yes, a healthy lifestyle, that is a best thing which we can adopt, even to make menopause more than just a set of hot flushes and night sweats. So I generally advise all my patients on a healthy lifestyle, and I stress a lot on making exercise a part of their daily routine. I think, at least in this age group of people who are like menopausal women, if they perform yoga regularly, that is actually very, very soothing. And
so even if they start at this point in time, it will be beneficial for them?
Oh, it's better late than never.
Okay, of course.
Okay, now one last thing before we wrap up on that is, how do you think that anxiety, depression, hypertension is going to have an impact on the mother who's actually pregnant?
It does have an impact, and actually the calmer the mother is, the better is going to be the outcome of the baby. And anxiety and depression, most of the things can be alleviated by proper education of the patients, and we should give them information leaflets and in the hospitals. And obviously, like, we are holding seminars right now after this conference, after this TV show. I'm going to Quetta to attend a conference that is again being held by a Society of Obstetricians and Gynecologists of Pakistan, and all the leading gynecologists are there, and I'm going to join them right shortly. And that is again to conduct awareness, carry out awareness, inform people about the common issues which are going to be there. So it's just like hammering those things again and again and again, so that people start taking them and assimilating them.
And one last thing, and that is, it's a myth over here in Pakistan, ladies and gentlemen, for anybody who's actually watching us from outside Pakistan too as well, and that is that when the mother is pregnant, what they do is that they put a cute baby's picture right in front of the mother, and they say that, if the mother's going to take a look at this picture, the baby's going to be cuter too as well.
It's true.
I mean, do you think that there's any science to it? Do you think that it has an impact? Do you think that it is a myth, or do you think that it's a myth busted?
As far as auditory signals to the baby are concerned, what you listen and what the mother has been doing, they do have an impact on the growth of the baby. But as far as seeing the picture of the baby, at least I'm not aware of it, that this has any scientific value, because the looks and all that is because of specific genes that you acquire.
Yes, exactly.
So
I just think it's for the mother to feel better and to maybe have calmer thoughts about the baby. It has nothing to do with naturally.
And since you talked about genes, I'm very sorry. One last thing, and that is that many a times when the baby is born, so then their grandparents and the entire family comes together, or he resembles his grandfather, or no, you know, she resembles her mother, or things like that. When do you think that the genes dominate, whether it's the father or it's the mother? Whose genes are going to dominate within a normal delivery, as we say?
It's not
And
like,
how does it matter?
I don't think that you can say that the paternal genes are dominant or the maternal
No,
genes
is there
are
a way where we can make our genes stronger so that the baby looks like us?
not really, but you know,
But there is
for
biotechnology.
all genes, there are dominant genes and there are recessive genes for
yes.
different diseases, and they can be and different normal traits. So they can be present in the father and the mother, and the baby is a mixture of those dominant genes from
Exactly.
both the sides.
And you know, we're definitely going to request you to come over again as well, because we didn't talk about the IVFs as well, and you know, there were some other issues. But thank you very much for being with us. It was lovely to have you.
Yes, of course.
Thank
Thank
you
you.
very
Thank
much
you.
for wonderful pieces of advice as well. Shiza, do you want to say something?
Well, I just feel like all of these two segments were so informative for me. I mean, I was literally quiet all the time because I was learning a lot. I think the
Are you
same
trying
goes
to
for
tell me that, you know, I was talking a lot?
No,
Well,
you
it's
were
all
as
right.
well. No,
It's a
but the guests
teamwork.
were amazing. I mean, the information that they were giving out
it
was
is.
actually amazing.
It is.
And if you actually learned something from us today, please pass it on to other people.
Yeah, exactly. That's what we need to do. And what you can do is that if you need more information on this topic, you can write to us on our Facebook fan page, which is with the name of,
Well, this morning.
on Twitter,
Well, this morning without a G.
on Daily Motion and YouTube.
Well, this morning.
And the fabulous repeat's going to be at
5 past 11 in the night.
till the next time. 1, 2, 3.
Good
Good
morning.
morning. Thank you.